Back to the office when
All right, it looks like we've got enough here, so let's get started. Everybody a chance to look over the minutes. Can I get approval for the minutes or
So moved.
Second.
all those in favor?
Aye.
Aye. Okay, on to old business for the clinic.
So we're finishing up the smart campaign that we were talking about. It was, kind of promote, back to school shops. We didn't do as well this year as we have in the past, but we did get 30 to 35 kiddos and, passing out the, ice cream coupons. So we're finishing, wrapping up that, but if they still come in, we're still following up and doing the coupons and going like that. We still have kids that are going back to school and realize, oh, I forgot shop, so we're still working on that. Finishing that up. Full-time RN was approved by the commissioners and council in September meeting, and then Shannon just sent me 3 resumes, so we will start going through that and start looking at those to start interviewing and hopefully find a candidate here pretty soon. So communicable disease, sorry, the pertussis disease out there seems to be slowing what we're hearing. We don't have many reports from the state, so they're not getting tested, but they are getting treated, which is good, so we're not spreading the love to everybody. So that seems to be slowing down, but our vaccination appointments are still busy right now because they're still trying to keep their babies protected, which we are glad and happy to help them and bring them in as fast as we can, so. That's all I have.
Okay. Environmental.
So for the mosquito sampling, as of September 30th, there are 27 human cases for West Nile virus in Indiana for this year. Currently there's 1 case in Allen County, 1 in Jay, and 1 in Wells. So in our conversations with the state, the expectation is that there's probably at least a case here in Adams County. They just haven't had symptoms that were bad enough to seek medical care at this point. These are the highest numbers of human cases in Indiana since 2012, when we had our last big drought year. Adams County currently has 12 horses that have tested positive for West Nile virus, and most of those have died. State hasn't given us the exact number that have died, but they have said most of them have passed away. This was the first year that we started doing our own trapping. It's been successful. The traps were set and collected. The mosquitoes got shipped to the state for testing. We've sent in samples from 30 different areas so far this season, 12 of which have tested positive for West Nile virus. So it's definitely in the county. And Tara's been working with Jeremy Gilbert of Decatur on their program because their previous employee that did all of their mosquito stuff retired this year. So she contacts him every time we get a positive sample, and then he has someone go out and spray, and they just started spraying all of Decatur instead of trying to just pick and choose the areas where the positives were coming from. And then Bern and Geneva also have their own sampling and spraying programs that they run themselves. And they're going to continue to spray until we have our first hard frost, which is what we generally consider the end of mosquito season in Indiana. Typically we say it's April to October, but who knows when we're gonna get that first really hard frost to kill them all. So it's been an active program this year. And then for software update, I had mentioned last time that we were going to be getting the new birth, death, receipts, and complaints programs installed. And those have been installed, completed. We've been using it for a little over a month now, and I think everyone's really happy with the programs and how they're working for us. They're working really well. So that's been good.
Will you enter old stuff into that, or is that only from a month ago forward?
For which, so like
For the birth?
Those are all, it's all been back entered in there.
Okay.
The software company did that. They back entered everything.
So they took all them books that you've been working on for.
Teresa's been entering the
Yeah.
books. Yes, everything that she's entered got shifted into that.
Oh, good.
Mhm.
I remember that was a pain for you guys. That was
Yes.
a lot of work.
Yes, and now these new programs actually talk to the state's program, so we don't have to enter the new ones anymore. That it gets entered.
Really?
So, except for the home birth suite, still have to
Mhm.
enter all of those, but the hospital births come through the state program. So it
That's
should make
good.
things more streamlined for the whole process.
And probably a lot quicker to look up.
Yeah, and doing, I know Stace could talk about the receipt program. It's probably been a lot nicer to just type it up quick and print it out instead of having to handwrite everyone's receipts too. So, and it helps with our deposits and report of collections and that sort of thing. We've been working with the auditor's office on getting that so it looks right and meets all the requirements of State Board of Accounts. So, it's been good. That's all I have.
Okay. Let's move on to new business. Do you have anything with the clinic for that?
So we're starting into RSV season. That usually starts in October. So we will start giving that RSV vaccine to the little babies to see if we can push that. We don't have that for pregnant moms, but we do have it for the little babies. So we will start that here today and start moving forward. So hopefully we'll get takers on that one. Communicable disease. We have seen a Haemophilus influenza again in Adams County. I think this is number 5 in 2.5 years. Most of these kiddos are unvaccinated. Our District 3 epidemiologist will follow up on this because it is vaccine preventable and the little one's a toddler under 7, so I don't follow up on this. But from what I'm understanding, the little one doing well and left the hospital fairly soon. So it sounds like they got that in the very beginning, which I'm for that. So moving forward, just the doctors here, you can really push Haemophilus influenza to give and DTaP would be greatly appreciated. So we're really pushing that, trying to educate people on how important those vaccines are. It's out there. A lot of people don't think it's out there, but we have all that stuff out there because we're having people not vaccinated anymore.
Do you have your supply of flu vaccine too? Have you gotten your?
I will be getting that. We ordered it. We've been waiting on it. So I just got an email said it was shipped. So we are, we do have our adult. We have the adult flu for the 317, yeah, which is people with no insurance. We have the private flu. We have private insurance flu, and I'm waiting for my BFC. They just shipped it, so we're getting that back. We had it yesterday for a Geneva clinic, but it was delayed. We didn't get it, so I think I ordered that 2 or 3 weeks ago. So we're just, yeah, but we do have that. It should be here. I'm hoping and crossing my fingers and saying I pray it'll be here this week.
Anything else? Questions for the clinic? All right, environmental.
Okay, I'm gonna have a lot.
Okay.
So for the food report, since Tara's at fall conference right now, I'm gonna give her report for her. So she said on September 20th, Decatur hosted the Hispanic Festival downtown and they had a great turnout. There were 8 food vendors that the department permitted and inspected and everyone complied with the requirements. She reported that since the last meeting, she's done 53 inspections, citing 15 priority violations, 22 priority foundation violations, and 25 core violations. And just for board's reference, since we're not doing critical and non-critical anymore, the priority are those that could contribute directly to hazards associated with foodborne illness or injury, like our previous critical ones. Priority foundation are those that support, facilitate, or enable priority items, so non-critical. And then the core items are those related to general sanitation, facilities, structures, equipment, maintenance, things like that. So that's what she has done since the last meeting. So in relation to that, I think Stacy passed out the food policy. This is the one that we had passed a couple of years ago, or that you all had passed a couple of years ago. So since the state food code has been updated, we need to update our enforcement policy to reflect that updated language, the priority foundation, and core. I don't know if Luke wants to talk any more about it.
Yeah, so essentially our ordinance already allows us to impose fines or other penalties or whatever for restaurants that are not complying with either our rules or state statutes. But we didn't, until a couple of years ago, have a whole lot of a concrete plan in place for how we were going to do that. So we did this policy, I think it was signed in June of 23. just to lay out, all right, here's how many critical violations or repeat violations or whatever, when we will start triggering fines or when we'll start triggering other penalties or other things. That was all based on the old state law, though, that had the critical and non-critical violations. So with them having completely overhauled that, getting rid of that language, this update here is very similar, but now there's 3 different categories with the priority foundation, the core items, and just sort of refreshes that to meet the new statutory language. Because this was just handed out this morning, I mean, it's entirely up to the board whether you want to process this and come back and we can vote on it in December on whether it is something that will pass or if it's something that you want to talk about and vote on this morning, whatever, that's entirely up to you guys, but I'm gonna go ahead and get that, because it needs updated now that the statute has changed that significantly.
Is this like a first reading or will it have to be 2 different readings or how we
Since
do
it's-
this?
It's just a policy, it's not an ordinance, so we
Okay.
don't have to go through all of the reading, public comment sorts of things that an ordinance change would. This is it's entirely within, everything that's in here is stuff we could already do without a policy in place based on what our ordinance says. We just think it's better to have some parameters that we're working within. When we start to put lines in or start to require people to show up before the board and explain why they're not correcting certain violations or some of the different things that we do, so.
I don't know if Tara talked to you about it, but she had said something to me about hoping that if it was to be passed, that we would try to make it take effect January 1, since the state's not wanting us to actually write the new violations, just to do education until that point. Obviously, if it's something that was in the code before, we're writing it, but the new things, we're just educating on. So she thought maybe it would be better if we waited until January, making it effective January 1, so that it aligned with when the state code was.
And if that's the case, given that it was just handed out this morning, there's probably no reason to
I
vote,
would
there's
move
probably
we-
no reason to vote on it today, but that's your decision,
Yeah,
so.
bring it in December, but I would move. To vote on it in December, yeah.
Do you have a second on that motion?
Does this meet what you're wanting as far as you and Tara? I mean, I'm sure it is because you
Yeah,
wrote it, but I mean,
It's
is it?
very similar to what it was previously. There's been a little bit of change as far as,
I mean, most of the changes, the priority items have essentially replaced the critical violations. The priority foundation has essentially replaced what was non-critical. It's the core items that we didn't, it's kind of a new category that they put in that didn't fall under new things, so we had to sort of rework and create a new section for that, but largely it's accomplishing the same things that we had before.
was there something about non-consecutive or consecutive?
Yeah, there was some difference in, with the core items, those ones are more facilities based, right? So a lot of our priority foundation, critical, non-critical, whatever, are the kinds of violations that can be remedied very quickly, where it's, if you got some refrigeration issue or something like that, it's, hey, you need to get this fixed in 15 days or something. The core things, because there's more facility elements, maybe you got an issue with your flooring or something like that that needs to be replaced, or, those are things that we can't reasonably expect somebody to turn around and get fixed in the snap of a finger. So I think the rule in the statute maybe is to give up to 90 days or something like that to fix those. We had done a lot more focus in the old system on not imposing things until we saw consecutive violations of the same thing. Well, if we were talking about a violation that's gonna take 90 days before we can do a follow-up to figure out if we said we gotta do that, you gotta have 3 of those in a row. I mean, we're 9 months into this before we could do anything, so we've kind of eliminated that. I've left a little more up to, we're gonna give you a reasonable amount of time to get this stuff fixed. we may even give you a little bit extra time if you're showing some progress, but windows of time to fix things are that large. You don't wanna allow people to just continue to violate for months and months and months on end before we do it bigger, before we do it bigger. But yeah, I think, you know, it's not gonna be voted on today, take the next couple of months and stuff like that over, and then we can answer questions or whatever in December.
I'll second the motion that was made.
All those in favor of reviewing and bringing it back to vote next meeting? All right.
I do have a question. I see she did get up to 53. That's not quite one a day. I know the two previous meetings before, it was like 10 and 15. So she's picking it up.
Yeah,
Is that,
she'd been on medical leave too.
Okay.
So that was part of it. But yeah, I think she's getting more comfortable with the electronic inspection software and everything's been entered now, so it's not a matter of back entering all the facility information and all that. It's already in there now, and the more comfortable she gets with it, I think the faster she's getting with using
Okay.
it.
I was glad to say, I mean, I know the previous two meetings, I think it was like
It
10
was
and
lower.
12
Mhm.
inspections, and there's quite a few establishments in the county.
Yep,
So,
absolutely.
all right.
And then she had something else too, so I'll talk on that. She wanted to give you all an update on environmental complaints. Particularly Swiss Meadows, and then just in general. We've had some ongoing complaints that we've received about Swiss Meadows. Mold, water damage and leaks, pests and filthy living conditions. So she's been working for a while to try to get those issues corrected. She sent a letter to the owners that they were to abate all of the affected units, and she sent that on September 8th. I believe there's been a lot of changeover with ownership there. The owners have been in touch with contractors, electricians and plumbers to abate everything that needs done there as far as the issues that we had noted. Tara has been in contact with an investigator with the homeowner protection unit at the Attorney General's office, Indiana Attorney General's office. So she's been working with her and forwarding everything that we have on this particular issue. And they're working together to ensure that they gave an abatement date of January 1, that everything be addressed on the property. And not just like Band-Aid fixed, but actually addressing the issues. So the goal is to make sure that those owners are held responsible and that nobody ends up having to be removed, or we have to declare properties unfit and then those people have to find someplace else to live. That's not our goal. So we're hoping that they comply.
Where is that on 218? 218 east of Burn?
It's on the west side, well, on the west side of 27 south of, just south.
Okay.
It's tucked away back there. And then in general, since the last board meeting, she's addressed 9 other housing complaints. 3 of those were specifically related to pests and feces. We currently have 11 properties that are placarded as unfit for human habitation. And she wanted to make sure to note that we try our best to compromise with owners and get things abated through agreements rather than immediately declaring their properties unfit. She said she's been seeing a lot of progress when she approaches things that way as opposed to just placarding right away. However, it does depend on the severity of the situation, whether that's an option or not. But that was all of the general updates she gave me on environment. She's just starting to use that new tracking software with those. So it's helping us keep track of when letters get sent out and when we get responses and things like that, or when the next letter is due, when next inspections are due. It's a nice program. Any other? No. Okay. Vital records. Probably gonna defer to Luke a little bit on this one too, but unless you want me to introduce.
No, I'll go ahead. So, general rule in Indiana, if you amending like a birth certificate or something, they should need a court order. Adoption, maternity order, something like that. The state does allow certain amendments to be made without a court order. Minor spelling changes. They can even change the date of birth, only if it's the day, not the month or year. A couple of small things that they allow, just through a more informal process. My understanding is those rules haven't changed, but the state is getting much pickier with those. And so we've had some instances recently where what we consider to be those sort of run-of-the-mill amendments come to us. We've done the paperwork for them, submitted to the state. The state has come back and said, no, we're not going to approve that amendment. You need a court order or whatever it is. So my understanding is because the state is starting to get pickier with those, we are contemplating not doing those amendments through our office anymore. So I think people can go directly to the state for those, right? And I think there are other counties who have stopped doing those amendments themselves and are just having people do it at the state
Allen
level.
County, yes. They're kind of who we defer to on a lot of things. For the North region, Allen County is the main point of contact for the Vital Records Associations. They're kind of who Teresa defers to when she's got questions.
So I think what we're wanting to know, kind of from the board's perspective, on whether we think we should continue to do these amendments or whether we should follow Allen County's lead, I guess, and say you might need to handle these at the state level. Forms or affidavits or whatever that you submit, do those yourself, because I don't know how many of them get. I don't know how often this is coming up. I'll defer to you with that.
It's not super frequently, but we've been, ones that have been approved in the past, we were doing them the exact same way we've always been doing them. They're getting denied. She's had two in the last month, 6 months. In fact, a couple in the last 6 months or so.
What do they want changed? The name or?
They wanted to change, well, I think one was like Marie to Maria, like change a
Is
letter.
that or the inverse? I can't remember.
Yeah, and then the other one, was a middle initial.
No.
And they denied that.
They denied it, and they had previously been approving those types.
Well, I'm assuming they're just taking a narrower definition of what it's supposed to just be a spelling change.
I think they're viewing that as potentially, like I said, like an
That's
entirely
it's an
different
entirely
name.
different name now we're dealing with, so they're just taking a narrower view of it.
So if somebody wants to change it, they just go online and get the forms off the state website or, I
Well,
mean,
if they're meeting one of those categories, if it's just a spelling change, a minor spelling change or something like that, yeah, I think they're available on the IUH website.
Otherwise, those things that they're considering bigger things like full name changes or things like that, have to have a court order. So even if we have had tried to do some of those in the past, they would deny it and say no big. So I don't know if Teresa would rather we just make up some kind of policy that we just don't handle them in-house anymore, and it's either you just get a court order and have no issues, or go through the state's process.
Is
So-
there any benefit to somebody who wants to do a minor spelling change? Is there any benefit to them coming to our office versus doing the ones and sending them into the state? Other than the postage or out of an online form?
I mean, they'd have to go through the state for that. We just give them the state's number.
Like phone number.
that's why I was gonna suggest some kind of contact sheet that, hey, we aren't handling this anymore, but here's a one-page sheet of, here's the number you gotta call or the website you gotta go to get the forms, and then you take care of it then.
But they're not gonna let us do anything right now.
Well, I think they would let us, but the things that we've been allowed to do, they're, like Luke said, they've got like a narrower view of what's acceptable, things that they used to accept.
So there
that
is a
don't-
few things that we
Yeah.
could possibly do still.
Potentially,
But
I'm
you
not
still have to
sure,
have
but
the
it's just so
approval.
hard to know what they're gonna accept and what they're not gonna accept. And when we try to process it ourselves and then they deny it and say you need a court order, it's like, should we have just told people to just go and get a court order?
Sounds like
from the
wasting
start?
your time.
Yeah, like we are wasting their time because they're not gonna let us approve those things anyway.
I mean,
That's the conflict.
I'd be in favor of just having, either point them in that direction, or if you wanna do it all the time, it's a lot of times easier just to have a sheet. Here's everything you need to know. You go ahead and make the contact, rather than guess what the state's thinking and, oh, you're wrong.
We can
you know.
call the state and see if there's a form that they would need to fill out.
Or a list of things that you're allowed to do without question, because if there's nothing, there's no need for us to even be involved in it. That's a state deal, but if there is some things that we can do, I don't wanna go away from that because, dealing with the state is not easy. I mean,
Oh, yeah, like we have, people have to deal with them for like delayed registrations and stuff like that.
Yeah.
It's a mess.
but check with them, bring it back to the next meeting, I believe, and say, okay, we can do this, this, and this, but from now on, what we've been doing, this, and this, we cannot no longer do. And then as us as a group, we'll just say, okay, we're done. We're gonna wash our hands from it, or we're gonna stay as is. We just know that we can't do these things. Is that,
And we would just potentially have to do a policy, I would assume, like a board policy, like we did with the food stuff similarly, that just outlines what we'll do and what we won't do.
Does it depend who you talk to down there? I mean, does one person let you change the middle initial and the next day you call somebody else, oh no, we aren't gonna okay
No,
it?
I don't think so. I
Okay.
think it would be
It's generally the same
the
person
same
that we
person.
deal with.
Yeah.
Okay,
They're all very specified in what they do down there.
For what it's worth, I have the IDOH website pulled up right now, and they have a page on corrections and amendments to vital records, lists. Here's who can request it, here's what can be changed, here's when a court order is needed. And at the top of it, it just says, basically, here's a phone number, and it's a 317, it's for the state department there. It says, if you wanna make one of these amendments, call this number. So but it sounds like largely the state, but it's on the website. It's not like they're leading with, go to your local health department. They're leading with call us and get handled. So I think it's really more of a courtesy service that we provide, that we are under no obligation to.
I think they're also getting a lot pickier with what documentation they're accepting of.
Yes.
They can't see the seals as well.
A lot of school records and stuff, we used to be able to accept those. Well, they don't have seals on them, so they're going away from some of that stuff. Well, a lot of these people don't have with like a notary seal on them or whatever. So that makes it hard too. They don't have the documentation that they need. for
And is
the
it,
state.
the documents have to be at least 10 years
10
old.
years.
So it's not like they can just get a new document made and sealed unless they do court order stuff. I guess we can,
I don't know, I mean, I
Everybody
kind of
work.
agree with Luke. It seems like we're a middleman that's not gonna be much help except a resource to guide them to that. So if it's something similar that we hand out with that information to just be the resource to help, I feel like otherwise we're not gonna be able to provide much.
and we don't wanna tell somebody wrong. and
yeah,
then
we don't wanna
just-
like try to do it and then delay their process even further or think that everything's okay and then it comes back from the state that it's
to me, it
not.
seems like they've really narrowed the window what they'll accept. And the question is, how much dancing around do you people wanna do to help the one or two people that might make a difference? When you've got it right there on the website. I don't know, I hate burning personnel time.
So I guess we'll just
I'd say
table
any,
it or.
yeah, any further discussion, we need to table it or somebody wanna?
I mean, what's at the table?
Overviewing.
Do we need like an official,
Policy motion.
do we need like an official decision or policy?
I
or
don't think we need a written policy, but I think we're board to somebody make a motion and actually vote on for us to stop doing this, but to direct people to the IDOH resources.
I'll make the motion if you want that, hey, policy is that with new restrictions, we're no longer able to do that, but we have like an information sheet that they can take with them. I mean, to just read off a number, no one's gonna remember that, but direct them to the website or the contact
Print
where
that
they get
screen
that-
and
to where they can get that
look at
done.
it.
Yeah.
I'll second that.
Okay.
All those in favor?
Aye.
Anyone opposed? Okay.
Okay. And then budget report, copy of our budgetary status reports up in the office, if anybody wants to see it. Stacy, Chris, and Holly and I all sat down in August and we went through our current line item balances and we all agreed on what sort of transfers we might need, additions, transfers, all that submitted to county council. Those were all approved at their September meeting. For the next year's budget, we should be hearing what our approved amounts will be from council sometime this month. It's usually October that we get those approved budgets. And then we've been working with the state health department and the auditor's office to complete all of the preparedness grant paperwork on both the state and local sides of the application. So once we have our signed contract and we have to submit our budget to the state, and then there are several deliverables that were due by the end of September. So even though we don't have an executed agreement with them yet, we do have those deliverables completed. Polly and I made sure to get those done before the end of September, before yesterday. So those have been done. So we're just working on getting stuff. They had sent the paperwork to Carla and we had updated them that her email address was no longer the contact, but they still sent it. So it's been trying to get stuff changed, trying to get contacts updated and get stuff signed. So we're still working on getting that done, but it sounds like they don't even have 40% of the state with signed agreements yet. So it's been a slow process for everybody. That's all I have for that.
Does anybody have anything else to talk about? All right, motion to adjourn.
So moved. Second.